Okay. Thank you very much, Mr. Thaka.
Thank you very much, Dr. Amin. I will now invite Mr. Tony Kirwa, a representative of Referal Hospitals. Karibu.
Your Excellency, the Deputy President, the guests who are here, all protocol observed. It's quite a challenge to speak after giants have spoken, but I will attempt, Your Excellency, to speak. You know, speaking after you have spoken is really, and the senior doctors here. But what I will do is, we have already mentioned quite a number of what I had wanted to say. So I will enrich and concretize issues which have been brought here. Last week, Your Excellency, you met people with disabilities, and I listened to you. And we were saying, a country is judged by how much we support the vulnerable. There are no more vulnerable people like the sick people in hospitals. They are very vulnerable. And when you look at how much we allocate, Your Excellency, to health sector, both at national and at the county level, it's just 4% or less. Rwanda is doing 23% of their budget. So even if we talk about all these issues, and you have always said it has to be very deliberate, we have to be very determined and allocate resources where it is. 20 years ago, Your Excellency, 2001, there was a meeting in Abuja of African Union. And we agreed as nations of Africa that we'll put at least 15% of our money, 15% of our national budget. Now we are doing 4%, Your Excellency. We need to do something about that. Because Malawi is ahead of us, Seychelles is ahead of us, about 5 or 6 countries have met that, Your Excellency. So if we don't allocate that amount to health sector, then we will be grappling with a lot of issues at the county level and at the national level. We have said we will address issues of NHIF comprehensively. We need the money. I've seen we have belabored the point of NHIF. NHIF remains the, I don't want to say, maybe Dr. will oppose it, but the only silver bullet we have to fight in order for us to achieve universal health coverage. What we need to do is to turn it around. I don't know how we will go about it, but my position is this, Your Excellency, that anything we need to do to help NHIF, so that when I go to the hospital, or any person, or people who are below the pyramid, are able to get medication. That's the key thing. How we go about that, that is the elephant in the house. But for us who have worked with NHIF as a, user, as a beneficiaries by being treated and helped by them, we have seen they have issues with the human resource. It's a big issue. Go to Eldoret. They are not able to process those issues. Issues of ICT is becoming a problem. And the numbers. Hospitals are marketing for NHIF. All of us, leaders in the churches, join NHIF. So the numbers is overwhelming. And we need to find a way of helping NHIF. Now, Your Excellency, with the help of the budget which you will allocate, I'm sure for that, we will really focus on issues of family medicine, family health, community approaches, population health, that will be cost effective and has high impact. These institutions which we are building, through devolution and whatnot. We have to find a way of linking them at the grassroots level, from the household up to the national referral hospital. We have to find a way so that they can impact. We have to put a lot of emphasis on, Your Excellency, on prevention. We have talked of prevention. We need to find a way of preventing these diseases. Early diagnosis, we have to find a way, and the referral of common diseases. You have asked us whether we need to do something about the referral institutions. Your Excellency, you are aware that we have about 5 or so referral hospitals. The Apex, the level 6, the KNH, the Mtrh, the Kenyatta University Teaching and Referral Hospital, Mwai Kibaki in Othaya. Now, when we say these are referral at the Apex, we need to support, totally support, in terms of infrastructure, manpower, technology, talk about anything, so that we don't need to refer a patient from one of the Apex hospitals to another Apex hospital. There's no point of us in Mtrh referring a patient to KNH, just because we are not funded the same way KNH is funded. It doesn't make sense. So if we say these are Apex referral institution, let it be seen that they are really Apex. Now, those Apex referral hospitals are not enough, Your Excellency. We need to cluster areas, counties. And we are proposing in this meeting, Your Excellency, that in Garissa, we should have a referral hospital. Of the